those of you who may not have participated in one of our APC meetings before, I don't like to do slides. I am kind of, some people might even define it as a bit rude, but I kind of jump in and I ask questions and I ask them what I think are the questions that people want to know, and sometimes they're not necessarily having access to those of you who are participating in our panel to ask those questions. Folks may chime in and put in a question in the chat, and we will ask and answer those. But really, what I try to tell people that it is like having a cup of coffee with me. Like, I think about this as that we're sitting around having a cup of coffee, and so that's how the questions will go. I think that, I know some of our government officials prefer written questions that they have a prepared answer to. The answer, I don't know, and I'll get back to you, is more than sufficient here. And definitely if we need it, we kind of are okay with that to get information out to folks later on. So with that, I'm going to go ahead and I'm going to get this party started. Again, want to say thank you to everybody who is taking time out of their day to join us. I know also today is the solar eclipse, so I know some of you might be running out of your houses to kind of blind yourself in the eye and look at the solar eclipse with unprepared vision or protection. So don't go do that. That is not a recommendation. If you don't have the appropriate equipment, please do not go stare at the sun and say that we told you to do it. Our liability insurance does not cover retina stinging or whatever that is called. Okay, with that said, we're going to introduce our great and illustrious panel to you today. Ali, do you want to go first? Because I think you're the highest ranking official on the call. Look at that. Because look at that. You never, there you go.
I don't know about that, but my name's Ali. It is good to be with all of you. I'm at the U.S. Department of Labor, and I focus on, for today's purposes, I focus on health insurance that you have through your employer.
Perfect. Tonya, you want to go next? You're on mute, but I'm not going to judge you for that.
All right, thank you. Tonya Triplett, the Director of Economic Development and Tourism for the town of Abingdon in Abingdon, Virginia.
Perfect. Rachel, do you want to go next?
Yeah, I would love to. Hi, everyone. I'm excited to be on this call. My name is Rachel Kaplan. I am a consultant working with the South Carolina Office of Rural Health on a 3-year grant that focuses on recovery-friendly employment.
Perfect. Thank you. Ali, one of the things is that, I always I use this analogy of a train that's roaring through the Appalachia region. Say the engine of that train is was the Oxycontin crisis, many folks know, and now it's polydrug use with hepatitis C, hepatitis B, A, and then workforce development, economic development, educational attainment challenges, and then the caboose of that train being HIV, and then the environmental, economic, and psychological impact of coal. So when in your office, help us understand what your office does around labor force, particularly people either in rural communities, folks with lived experience, or employers seeking to hire folks with lived experience.
Yeah. That's a great question. And I'll answer it a couple of different ways. First, most directly with kind of my day-to-day and the part of the Department of Labor that I sit in and what we do. So there is a law called the Mental Health Parity and Addiction Equity Act, which has been on the books for about 15 years. It'll actually be the 16th anniversary in about 5 months. And that law stands for a pretty basic proposition, which is that if you have health insurance and your health insurance covers mental health benefits, substance use benefits, then you shouldn't be discriminated against because you're trying to seek those benefits as opposed to like the traditional medical treatment that people might otherwise think of when it comes to health insurance. Unfortunately, it is the case that all too frequently there is that kind of discrimination that happens. And so we have a lot of work that is focused on that issue. It's a priority for this administration, for my agency to to really try and rectify that and get us closer to the promise of that statute of really being in a universe where it doesn't matter what you're trying to get treatment for, you're going to be treated with the care and compassion that you deserve. An example, I'll give you a couple of examples of that. We see in the substance use context, we will see health insurance that provides coverage for urinalysis. It's where you give a urine sample and that's tested for various things. It's not uncommon with any number of medical conditions, but it can be an important part of treatment for substance use, is that urinalysis, again, to check for prohibited substances in your urine. And what we have seen and really tried to address is insurance companies say that they'll cover urinalysis for any number of conditions, but if you're being treated for substance use, then it won't be covered across the board. It's just blanket excluded. That's not appropriate, and so that's a kind of thing that we've tackled under this law. We have, in my agency, we have civil and criminal enforcement authority, and we have rulemaking authority. So we're kind of tackling this through both of those avenues. We have investigations that are going on into these issues, and we're also updating the rules to make it more patient-friendly. But stepping back
Ali,
from, go ahead.
Ali, can you go back one step for me and repeat the name of that law and the number of that so that people can write that down and look it up if they want to? This is
Sure.
where probably have a slide. I know everybody's saying this is where, see, if you had a slide, this would help, but we don't. Okay.
No, I don't like slides. I don't want slides. It's called the Mental Health Parity and Addiction Equity Act.
Okay.
And it was signed into law it's called the Mental Health Parity and Addiction Equity Act of 2008. That's when it came into effect.
Perfect.
Now,
thank you so much.
Yep. So stepping out of my part of the department and just talking about the department more broadly, there are a number of other ways that we intersect with this, because even for my part, we know that addressing mental health parity is one part of this challenge. There are other ways that individuals that are getting treatment for a mental health or substance use condition are stigmatized. There's other forms of discrimination that they face. And what we want to do is make sure that both the system is there and is going to treat the people with these conditions, but also people feel like it's okay, right? Because we all know, if you know anyone that has a substance use condition or a mental health condition, sometimes one of the biggest challenges they face is being okay to be a bit more public with it, not kind of writing a letter to the editor public, but even telling their family, telling their employer, telling their healthcare provider that they need help with a medical condition, because these are really all medical conditions when you get right down to it. So there are a number of things that we're doing in that space. One is kind of working with employers as we can to try and encourage them to do things like offer recovery-ready workplaces, offer mental health training to employees. I would say that's important, particularly for supervisors, because one of the things we know from academic research is that if you reach the point where you're willing to tell someone, your employer, for example, your supervisor, that you have a mental health need or a substance use need and you need to get treatment, that reaction that individual has can be critically important to how successful your treatment is and whether you seek treatment, right? Do you get the, come on, walk it off treatment, which is really unproductive? Or do you have someone that comes to you and says, I understand what you're going through. We're going to get you the help that you need. It's not asking employers to suddenly become licensed therapists and actually cure the conditions, but making sure that they understand the important role that they can play in supporting their workforce and getting them to be healthy, which is in their interest as well from a dollars and cents standpoint, because it means people are more productive. And then the last thing I would touch on is understanding that one of the challenges that we face as a country is that there are not enough trained mental health professionals who can really speak to the individuals with these conditions, help them understand how to get better and help them kind of get the treatment that they need. And there's work that our Employment and Training Administration is doing to try and really emphasize that as a potential workforce path for individuals. And I would say one of the things that we are particularly interested in that space is what's called peer counseling. where you have individuals with lived experience. They don't necessarily have to be like clinical professionals, but they get some training. You can kind of bring them on board pretty quickly, and they can do things like, group conversations where they can bring their lived experience to bear in these conversations. And it can be a real bonus to the healthcare system because not every condition requires someone that has, a PhD or a medical degree or all of those kinds of things for things like some forms of narcotics use, mild depression, just to use two conditions, for example. It can be very powerful to just have that conversation where really the primary engagement is with individuals that understand what you're going through and they can help you go through that. We all probably, most people, even if you're not familiar with the intricacies of the mental health care system or substance use system, you're familiar with AA. This is the AA model, right? Where it's not that you have a bunch of, people that have gone to school and are professional psychiatrists, as much as you have that community of people that understand what you're going through and support you in your journey to getting better. And so there are ways in which that model can be spread more broadly, and that's a thing that we're very interested in.
I always think it's really interesting. I wonder how many people know that the Department of Labor is in this deep in this fight with us to really address the need for, number one, understanding in the labor force, but also helping, I think, businesses, because I always think that that's the, if you will, the where the rubber doesn't necessarily meet the road. How do we start to have new conversations with businesses and the business community about hiring and hiring practices? Because we've got so many folks, particularly in rural communities, who have lived experience but may have either prior conviction or active addiction or active use, but they still want and need employment. So how do we begin to have conversations about how do we employ folks in these communities with these histories, with these experiences, because they're vital to a workforce that is in desperate need of workers. So next, I'm going to go to Rachel. Rachel, tell us about this project that you're working on and how it ties all into this. And then I have another little announcement I'm going to make after we get with Tonya. But go ahead.
Okay, yeah. So I am working on, it's a 3-year grant. So through the end of 2026 with the South Carolina Office of Rural Health. It is through the Appalachian Regional Commission. And so it's an ARC grant, and we're calling it the Dreams Workshop Grant. And I can put the acronym in the chat. It stands for Developing Recovery Supportive Employment in the Appalachian Mountain Region of South Carolina. So that's what the Dreams stands for. And essentially what we are doing is we are working in 3 counties in the upstate of South Carolina. So we're in Cherokee, Union, and Pickens. And we're working with both employers and individuals in recovery to help bridge the gap between employment opportunities. So it's working with employers so that they understand, some of the stigma and bias that they may not even know that they're bringing in to their workforce, and addressing things that they are bringing in that they know about and trying to engage them and educate them so that, we can make a positive change, so that maybe they can make changes to the way that they do their hiring, to the way that they view people in recovery as a valuable part of the workforce. It's also getting information and finding support resources for community members in those 3 counties so that they kind of know, hey, what are some entities, some plants, some agencies, some organizations, like all different kinds of work employment opportunities that are recovery friendly, that will understand that they have meetings that they would like to go to, that they have a schedule, that there's kind of an office culture that doesn't surround itself with temptation. What we've heard, so this grant was done through Prisma Health Upstate last year in Oconee County. And so what we learned through that, and just kind of collaborating with the entity who did that grant, is that people really want employment options, not just job options, where they can build a career and they can move up and they can find, things that are important and meaningful to them, and that a lot of the opportunities that were being given to them were in the restaurant or service industry, and there is traditionally just a lot of temptation and drinking and drug use. And so for people who are in recovery, that's not the best place for them necessarily. But if that's all that's available, it creates this really weird catch-22 of trying to find a position that works for them. So we're going to be working in those 3 counties. We're working really closely with 10 at the Top, which is the business employment organization in South Carolina. So they are helping us to identify businesses that are interested in recovery employment-friendly practices. We're working with Tedra Cobb, who's a consultant with the University of Rochester. She's going to be creating a workshop that's going to be going over for employers how to be a recovery-friendly workforce and what that means, and also how to support your employees who maybe they would like to go into recovery and have a problem, but they haven't acknowledged that yet, and they're worried about what that will do to their job or their reputation.
I want to come back. I'm sorry to interrupt you, but again, I warned you. But I want to come back to this for all 3 of you as the next question that I'm going to ask, which is how do we define a recovery-friendly workplace, right? Because I think it's different for a lot of people, and and it's like, is there what's the rule book on that? But I don't want to. You can finish up, and I'm going to go to Tonya. But I want that to be the kind of the next part of the conversation that we actually have. What is the definition of a recovery-friendly workplace? I know we're struggling with it now ourselves, right?
Yeah, because it can be so broad. Yeah, well, I'll just say the last thing we're doing, in addition to working with 10 at the Top, is we've also hired a peer liaison who's going to be helping us in all 3 counties, who is a person with lived experience, who's going to be coming out with us and getting trained on the Dreams workshop curriculum. They're going to help train on it, just so that we have that lived experience perspective, because we feel like that's really going to be the most important piece of this grant, because we can provide training and resources, but if people don't hear it in a way that really resonates with them, where they can see individuals in recovery as individuals, and not the stereotypes of drug addicts, then I think that that'll be way more successful in building sustainable community connections in those 3 counties.
Perfect. Thank you so much.
Yeah.
Tonya, what are you doing? What are you up to?
Well, we are working very closely with many organizations here in our small town. We're a very small town, about 8,200 citizens. We're part of Washington County that has about 54,000 citizens, and it starts at the very rural North Carolina border and goes all the way to Bristol, Virginia, and Bristol, Tennessee. Because we are such a small town, and the county actually governs us based on how the money flows down from the state on this thing. We're trying to work with organizations in our area. We have a Mended Women organization that's working very diligently to supply housing for ladies who come out of incarceration and who have these problems. They're also helping them get some interview skills and clothing that they can actually go to interviews and make an impression. Our employers are also really kind of laxing some of their qualifications so that they can help some of these folks get jobs. And as Rachel said a few weeks ago, I recommended one of my restaurants and hadn't really thought about the fact that it had a bar inside the restaurant. So I was thinking back of the house, front of the house, wasn't really thinking about that. So, there's a lot of work to be done to educate folks on where they can be and what is a good environment for them to be in. We're largely based on tourism in Abingdon. So we have over 30 locally owned restaurants, and, that's not the best hours and requires a lot of weekends. So that's tough, number one, to begin with. And then you add all of these other issues to the pot, and it really becomes a problem. Mended Women also is doing a lot of work on human trafficking in our area. So that's really, really nice to see, because one problem leads to other problems. So just trying to head some of those things off at the pass, and working in youth. So we've started several programs and scholarships to really help young people have other activities to do and keep them, on the right path to begin with.
Right. Thank you so much. One of the things that I actually wanted to announce, and I think it fits in very well here, is that Community Education Group has been very fortunate to receive one of the Appalachia Regional Commission RISE grant. And what we're doing with that grant is that we're looking at and utilizing a community health worker model that would use community health workers to work with medically assisted treatment providers in particular, but also to train those medically assisted treatment providers on the value of using community health workers. One of my philosophy being a couple. One is that I think that medically assisted treatment providers sit at the hub of where we can't find the HIV cases and the hepatitis C cases in this country. One, but two, I think that utilization of community health workers who may or may not have been participants in their program is another way in which they have a missed opportunity. And what we want to do is develop the curriculum that allows them to see that missed opportunity and then capitalize on it. I think that some of those MAT providers, and for those of you on the call, MAT being Suboxone, buprenorphine, methadone, or behavioral health providers, I don't think that we've had them engaged in that continuum of care, treatment, and cure and prevention. That's PrEP uptake, as well as treatment for HIV and hepatitis C and cure for hepatitis C, as well and as often as we could. So what we hope to be able to do is to create that curriculum, help them with developing and using our CHAMPS community health worker model, but also having conversation with them about the economic benefit of doing it this way. Meaning you can bill for the HIV screen, you can bill for the Hep C screen, you can bill for the linkages. So helping them increase their bottom line. They may not necessarily see themselves as a part of the continuum of care, treatment, and cure around HIV, but looking at them from a business perspective, a small business. And so I think that what we're trying to do is grow this network of providers, but also grow and infiltrate the social, sexual, and drug sharing network of people with lived experience by educating, making sure we're screening for HIV, screening for hepatitis C, and where we can to get folks undetectable if they're living with HIV, offer PrEP where we can in a new community, but also being able to provide hepatitis C treatment and cure options for them as well. So I'm super excited, super proud of the team at Community Education Group for doing this. But this leads us right into this conversation that we want to have at the summit, May 19th, 20th, and 21st, which I know many of you will be participating in. So it leads us right to the front doorstep of this question around what is it that is an employer that is the employer that we want to be sending these folks to. So I'm going to start with Ali. Ali, tell me what you're thinking or what the government is thinking when it thinks about, an employer that's good for people with lived experience.
Yeah, I think, when it comes to what is a recovery-ready workplace, there's a couple of different facets to it. One is kind of before people are your employees, right? What are the ways in which you're attracting kind of the full breadth of the talent that's out there and not discriminating or limiting people based on their substance use history? That's I think fundamental to being recovery ready. The other parts, though, are once people are on board and thinking about, Tonya was using the example of the restaurant industry, which is, pretty well known for high rates of substance use. And so if you're, let's say, a restaurant owner, what are the steps that you're taking to kind of mitigate that risk that is just kind of inherent in certain jobs, right? construction jobs, there are unfortunately really significant problems with opiates because construction is a physically really demanding job. People get injured, they get prescribed an opiate because the injuries are that significant, and then they never really get off that drug, which was originally prescribed appropriately. So kind of thinking about how you're going to prevent an addiction from forming and what steps you're going to take. And then the last part in my mind is all of the kind of support and education that you have. I talked earlier about, making sure that the workforce is educated about how to respond if someone brings something up, making sure that your employees, that you have kind of supportive programs in place and that your employees are aware of them. This I don't think is like definitional to being a recovery-ready workplace, but thinking about how leadership talks about these issues, right? Are you having a message from like the company president or the foreman at the job site who's saying, look, maybe that individual themselves has lived experience, but even if they don't, they're talking about things in a way that make it okay to have a condition and okay to get treatment for it. And kind of how do you make sure that your employees, if this is the situation that they're in, they feel supported and they feel encouraged to go and get that treatment?
Perfect. Rachel, Tonya?
Yeah, Ali, you said a lot of really great things. The one thing that we want to make sure that we're doing also is making sure that employers understand that this falls under the definition of a disability with the Americans with Disabilities Act. And so, making sure that employers know the rights of their employees, but also making sure that we're providing a resource for potential employees and for individuals in recovery, especially in these 3 counties, so that we can say, hey, these are your rights. This is covered under the Americans with Disabilities Act. You shouldn't be discriminated against for this. Just so that people feel a little bit more comfortable knowing what they have to and don't have to disclose and how to talk about it. And then even just some really simple things like reframing the way that office culture is with office get-togethers and bonding activities. I know during COVID, a lot of the ways that teams and employees were staying connected were doing virtual happy hours. And so for somebody who they either just don't drink or maybe they're in recovery, that doesn't feel very inclusive of an activity. So just even getting people to realize that when you're doing team bonding activities, it's not just about going to the bar with your colleagues or like having an office holiday party where there will be drinks, things like that, getting them to think outside the box a little bit more and be more aware of what other people are going through.
Yeah, we did this thing in Burke County, North Carolina, and it was it was a big reception. And Danny Scalise, who runs it, he was like, at one point they realized that they were getting ready to have this big reception, and it was going to be it was going to be, it was like a recovery reception, but it was all this booze, and so it turned out that it was also, the good news was that ended up being in dry January. So instead of having alcohol and mocktails, it was just mocktails. It was like there was no alcohol and there was only mocktails. And I think, some people are like, hey, where's the bar? But, it gave folks the opportunity to see what other people felt like when they go to an event and it's only alcohol and you have to say, can I get a soda or can I? And they're like, well, no. And it's a problem. So I really thought it was a smart thing to do.
Yeah, and I know we have a lot of plants, like bigger plants up in the upstate of South Carolina. So we also are really trying to get employers to understand that for a lot of the work that they're hiring people to do, the background check is an unnecessary barrier. And so just trying to reframe the way that a job application can look and what questions might restrict people, because if you need a workforce and there is a workforce available, why not change things up? It doesn't have to be the same application that it's always been just because that's what has worked before. It ends up weeding a lot of people out.
Right. I guess, Ali, and all of you, right? Do you see where employers are like, hey, enough of this woke culture talk with these people with lived experience? enough of this woke culture talk. I want you to abstain. I don't want anything in your system. And that's my rule as a private business in the United States of America. Bam. So what do you do with that employer?
Yeah, I think we're all kind of on our own journeys, and not everyone's going to be in exactly the same place. I mean, I think if I encountered an employer like that, maybe depends a little bit on what part of my personality is showing itself more. I mean, there's the enforcement side, in which case I would remind them that if they're planning on discriminating against those individuals, then they're going to have to answer for that, because there are legal protections for individuals with any number of medical conditions, including mental health and substance use conditions. But if that's not kind of the mood I'm in at that moment, probably the thing I would point out is that for most employers right now, one of the conversations that they're having is the difficulty in attracting and retaining high quality talent. And I think it's a pretty obvious question. If that's the situation that you're in and you're trying to attract talent, why would you ignore a substantial proportion of the potential employees that are out there, right? And like if an employer said, well, I'm just not gonna ever employ women. I mean, yes, that's illegal, but it's also kind of stupid, right? Because there are a lot of talented women in the workforce that are looking for jobs. And if you're just going to exclude them, then you're, like, by definition, not going to have the highest performing employees that you can.
Right.
So rather than leaving people on the bench, and there are a number of studies that show kind of the productivity benefits as well as the costs of turnover and things like that I think you can bring to bear in those kinds of conversations.
Childcare, housing is some other issues that really are barriers to the workforce. And we are working with United Way of Southwest Virginia, and they've taken over an old Kmart building, super Kmart building here in Abingdon. And very soon, probably before the end of the year, there are going to be 400 slots for quality childcare and for extended hours. So it's going to be 13 hours a day that people will be able to get care. They're going to provide meals for those children so that hopefully their parents can go to work and still have some time to get some counseling services or some help with their issues without having to worry about their children having meals and having to pick them up at 5 o'clock every day.
Right. Melissa, you had a whole bunch in the chat. Do you want to come on and say, that's Melissa from the AIDS Education Training Center from the Mid-Atlantic region? I don't know if she's still there. Oh, I can see you there. Do you want to pop on and say what you were saying in the chat? Or did she said it in the chat and she left? Melissa, are you still there? Okay, I guess she doesn't want to say anything about other than what she said in the chat.
I'm sorry.
And there you go. There you go.
I had to step out for a second to help someone.
And no, they tell you don't leave the meeting because then you'll be the meeting, and don't leave the meeting because then they'll talk about you in the meeting.
Yes.
Okay.
So I did not hear your question. I'm so sorry.
My question was about the comments that you had put in the chat. I was like, can you now expound on what you were talking about in the chat?
Oh, yeah, sure. I was just saying, we have an initiative that we were able to get funded called Mountain Maryland Forward. And basically it helps people that are hesitant about hiring to help cover costs for the first 90 days. And we also have a similar program through our local workforce consortium that does the same thing. And we're constantly working at getting the Second Chance Employer Initiative, reminding people, helping people understand it, because sometimes it's just they misunderstand what it means, and that people do change. I mean, we have 9 peers on staff here who have backgrounds and do a lot of really great work. but it's just educating others as to how great it can be to hire not just a peer, but anybody who's in recovery long term and doing well, or short term for that matter. So we're constantly doing that education work alongside our consortium as well.
Right. And so I guess that is one of my questions. What are the rights for an individual who feels that he or she's been discriminated against in the workplace? That the employer says, yeah, you meet all of the qualifications, but Joe told me that you used to use drugs, and so I'm not going to hire you. Or what is the challenge for an employee who's on the job and may say, I do need to go to some sort of treatment program, and whether they're going to ask their employer to pay for it or whether they're going to pay for it out of their own pocket. I think that's one of the challenges. And how do you begin to initiate those conversations with employers to say, here's the rule book before you get yourself in trouble?
I feel like people, if you're a business person, you should never even broach that subject without the risk of being in some sort of trouble. But I'm not an expert in law, so I don't know. But we do talk about it and how important it is to not even. I mean, you can ask questions, and a lot of times people will disclose. We've found a lot of people will disclose, yeah, I used to be incarcerated, or I used to whatever. But take a chance on me. I promise it'll be worth it. We have many stories of how that has worked out well for our local employers.
Ali, are there laws that will protect people with lived experience, or as somebody put in the chat, not just lived in the past tense, but folks that are actively using today?
Yeah, so I think it was Rachel that brought up the ADA, the Americans with Disabilities Act, which I'm not an ADA expert, but my recollection is it covers hiring and firing. And so there you have protections there. The other thing that comes to mind for people that are currently employed and looking to receive treatment is the Family and Medical Leave Act. You can use that to obtain mental health or substance use treatment. Those conditions are also qualifying for that. On that issue, the ADA is enforced by the Equal Employment Opportunity Commission, which is part of why I'm less familiar with it. It's not part of the Department of Labor. But the Wage and Hour Division, which is a different part of the Department of Labor, has put out guidance, I want to say like last year or the year before. Just to reiterate, it wasn't kind of breaking new ground, but we, just as part of this broader initiative, wanted to make sure people understood that they had that right to use family medical leave to take care. And that, by the way, is not just for their own treatment, because one of the things we haven't talked about is that there are really significant rates of mental health and substance use among youth. And so, for example, if you had a child and you need to take time off to help them with their treatment, that would also be covered by the FMLA.
Okay, so if I have a kid and I need to address basically, so like not just respite care, but if I need to deal with the legal issues, if I need a hospitalization, or if I need to go take care of the kid, or if I just need to focus on my family for a period of time, I could use FMLA for that.
Yeah, I mean, there are rules around how frequently you can invoke it and the number of hours you can take and all of those kinds of things. But yeah, as a basic concept, it's available.
Okay, all right.
I think there's some rules around size of company too, but I don't know all the details of that. Like if they're under X number, they don't have to necessarily, there's some intricacies. I don't know them, but I do know there are some.
Okay, so but there are rules out there. There are provisions out there, and there are protections out there. Maybe not as great as we want them to be, but there's some, like there's a floor and there's a threshold there. So, so Rachel, what's the hope for your 3-year project? At the end of it, what's supposed to happen? What's supposed to be in place? Is this a model that we'll be able to replicate throughout Appalachia, throughout the country? Tell me.
Yeah, so the way that we're kind of viewing this 3-year grant is that this is our phase 1, and that we would like phase 2 to be having this replicable toolkit and process and workshop that we can take to other counties in South Carolina and to other areas that would be interested too. We've done some research. We've looked at what other states have done with their recovery-friendly workplace initiatives, and we're trying to not necessarily recreate the wheel, but just make sure that it's really applicable for our area and the population that we serve. But we are considering this to be not necessarily a pilot project, but just a phase 1 of, what are the significant impacts that we can make, especially when it relates to employer attitudes and biases and getting people into the workforce the way that they want to be, and then figuring out how we take that to other areas. Because as a typically like a very rural state, there are already a lot of other barriers to employment. And so, we're going to be facilitating some interviews and some focus groups in July in these 3 counties so that we can hear from community members. They're going to be focus groups with employers and focus groups for people with lived experience, just to figure out what are the questions they have, what are the concerns, what are the barriers they already face, because we know that some barriers have nothing to do with whether there's any kind of history of use or if they're currently using or whatever it is. It doesn't have to do with recovery. Transportation is a huge issue for us because there isn't public transportation in a lot of South Carolina. So just figuring out what's important to the community and to community members and how we can help fill some of those gaps, knowing that we can't do it all, and there's a lot that's going to be outside of our purview.
Right. So Tonya, you were really kind of like outside. I mean, you're not like outside. You're not an outsider, but you are kind of like outside, kind of this public health paradigm that we're talking about. But you focus in on the actual needs of the business community, what's happening with them economically. What if I came to you and I said, what do businesses need from a labor force right now that you're seeing in rural Virginia? What would you tell me?
I would tell you people. I have restaurants who have the capability to serve in 2-story buildings. I have restaurants who are capable of serving that same building upstairs, downstairs, and on a porch, who haven't had all 3 of those sections of their business open since COVID because they don't have enough employees to open those spots. So therefore, what it does for me, who's very reliant on tourism and dependent on meals and lodging taxes in my community, I can't take bus groups now to some of these restaurants. They can't serve 50 to 56 people in their restaurant at one time because they don't have enough servers to do that, or they don't have enough back of the house. So from an economic standpoint, it hits us from the lodging portion. If there's if there's not enough employees in the hotels for them to fully open 86 rooms, then that limits the room nights. It's also limiting how many seats that you can get into a restaurant.
And so with that, Rachel and Ali, what would you tell Tonya to do this recruitment and retention? Because I think we have some level of agreement that folks with lived experience and folks in current recovery, the restaurant environment may be a little bit triggering for them, or may be overall triggering for them. What are we going to do to help support our local business economies, who in a lot of small towns, it is about tourism, and we've got this third rail sitting out there. Ideas?
The first thing that comes to mind is I've worked a lot of my professional life in the disability advocacy and disability awareness sector, and so substance use and mental health do fall under disability, but what I've found in working with people is that regardless of what their disability is, if it's invisible and somebody can't see it just by looking at them, they are very hesitant to acknowledge that they have a disability and to disclose it. And the places that I've seen be very successful with hiring are very upfront that say, we want people with all different walks of life, all different experiences to be a part of this organization. All these different perspectives make us stronger. And if they disclose their disability, then it makes the other person feel more comfortable. So I almost feel like the employer has to be willing to address, quote unquote, the elephant in the room by saying, if you work here, you can let me know what shifts work for you. If you have church meetings that are really important to you on certain days of the week that you need to make sure you go to, we want to make sure that that works within your schedule. If you go to recovery meetings or support group meetings, we want you to be able to go to those. I think it's just about kind of addressing it. And if they're making it a priority to be accommodating and to show that there's not this bias, then I think that employees are going to be more open about disclosing what they need and for what reasons, and not feeling like that's going to be the end of their job, or that, they're going to get fired.
Right. Is there like a sticker program? Put this window sticker in and we'll know that you're a second chance employer or a recovery specialist employee from the Department of Labor?
There's not a sticker program. There is a recovery ready workplace program. I put some information about that in the chat. I think I totally agree with everything that Rachel said. The one other thing I would add, just as kind of a concrete suggestion, if you're a restaurant owner, think about restaurants typically have this like dead spot, but kind of before happy hour and after lunch. Think about making your restaurant available for an NA or an AA meeting, for example, right? That is a really concrete way in which you can kind of show how important it is to you and how much you value that element of your workforce.
Perfect. What can we leave maybe? Because I know we have got like 10 minutes, and I know everybody's running to go see the eclipse. So I'm gonna give you probably 5 minutes of that back. And what I'd like to do is maybe take this last couple of minutes and go around one time with each of you and say, again, like that's a concrete example, right? Of using some of these spaces for recovery opportunities or for community-driven opportunities. Rachel, what would you say to these businesses, employers? Here's some things that you can do to let folks know that you are a recovery-friendly workplace, but also to let the folks know that you're safe here to disclose.
Yeah, I would say identifying individuals in your organization at different tiers and levels of, supervision or advisory positions, to feel comfortable disclosing something of theirs. Because when you create this opportunity to kind of share, then it makes it easier for other people to do that too. And I think putting concrete information in like the employee handbook and employee rules so that people know, because there's always a non-discrimination statement that a lot of organizations will put in there, and sometimes it's vague, or it will specifically relate to disability, race, ethnicity, but it doesn't talk about some of the other ways that people are discriminated against. And so I think if we have some updates to the employee handbook that make it very clear that this is a safe space and this is also a population that we're actively including, that would make a big difference.
Very good. And Tonya, how about you? What are the tools you need, and what do you need to be able to tell your business partners, hey, look, this is what you might need to do to be able to get those employees in through the door?
I think probably on our side, it's just going to be educating the employers on this. I'm not sure in this area that they've actually taken the time to really drill down and look at some of these things. We have got a small business development center. I haven't heard them broach this subject at all. And I think on the county level, there is workforce development boards that take care of those industries. But I don't know that my folks actually have ever had training on it. So that might be something that I want to pull this recovery ready workforce documents and share at my next tourism advisory committee meeting, and to make sure they have that in their inboxes.
Right. And so maybe one of the things that we can do on our side of the house is not, I guess, make the assumption that all employers are, you know, again, thinking the way we're thinking. Again, I come back to why we're doing the Syndemic Summit that we're doing at the Greenbrier, May 19th through the 21st. And if you haven't registered, please do. You know, one of the reasons that we're doing it is because I believe, and all of us at CEG believe, we've got to disrupt the silos that exist. We've got to get the economic development people to talk to workforce development and public health folks. We've got to get the public health folks to talk to workforce and economic development and labor folks. Because we talk about the impacts of these things, like I did with that train analogy, but, you know, folks usually stay in their car. They don't move up a class or down a class in car service. And what we want them to do is walk through the whole train, because we really and truly believe that if we don't do that, people will stay stuck. And we will have negative impacts at the community level. We will have businesses that don't have workers. We'll have people who want to work who can't find jobs. And we will have people who will be impacted negatively by stigma because people don't know what they don't know. So we hope that what we're going to be doing with ARC and our RISE grant will allow for individuals to learn more. Those businesses, we want to work with each and every one of those in Virginia, for the 3 states we'll be in, Virginia, West Virginia, and Kentucky, in this year 1 pilot that we're doing to increase their knowledge and awareness. So when I hear you talking, Tonya, what I'm thinking is, you know what, maybe what we need to do is I literally have something that we can go door to door to door to restaurants and figure out if they have labor shortages, have they thought about, you know, and give them some opportunities and some options. I think that what I'm hearing from Ali is there are materials out there, but we've got to make sure we're getting the materials and opportunities in the hands of the people that need them. And what I hear Rachel saying is that what we need to do is we need to be developing models that are going to work for people with lived and living experience, along with the employers that are likely to employ them. We can't kind of separate everybody out. So again, I think our job, like I always say, you know, our job here at CEG is to bring resources, opportunity, and attention to the Appalachia region. I want to thank the 3 of you for doing that today, of bringing the attention to what's going on in the labor market, in the labor force, and for the laborer. And I think that we have to keep all 3 in mind when we are trying to develop and design these programs. If you guys have any last words, I'm happy to hear them. If not, I will say again, thank you. And I will see you at the Greenbrier, May 19th, 20th, and 21st. Shameless plug.
Thanks for the invitation. Really appreciate it.
Thank you so much. I've learned a ton. So I really appreciate you inviting me in. And I'm now thinking about maybe some new knowledge resources that we have on a YouTube channel that's for small businesses that have about almost 150 new knowledge resources in marketing and customer service and all kinds of things. So it wouldn't hurt to have someone do a call on that and actually put that in our YouTube video so that these small business owners at their convenience would be able to watch that.
And we'd be happy to help you with stuff like that. You know, you can always call on us, and I'm sure I could drag Ali kicking and screaming after we got through the clearance and compliance process over there too, to have the Department of Labor really talk about kind of what the needs are of small businesses in rural America. Because I mean, we know that these are priorities, particularly for this administration, and we need to figure out how to get the information in the hands of the people that need it. Rachel.
Yeah, I just wanted to say thank you. This has been fantastic. And especially thank you to Raleigh for kind of bringing me into the fold. I've learned a lot too that I think will help the 3 counties that we're specifically working with for this next 3 years, and then other counties way after that.
We look forward to your success, Rachel, and learning from your 3-year process. I'd be interested in an update as you move along. and then to see what the end results are.
Yeah, I would love to
Yeah.
keep you. Yeah.
I mean, and I think that that's just it, right? I think that I'd love to learn, kind of what you frame out in these focus groups as we get ready to do focus groups across 3 states, including, like I said, Virginia, Kentucky, and West Virginia, and what you find in your initial kind of opportunity there.
Yeah,
Right.
I will definitely do that.
All right. And remember what I told you. We got 3 minutes left. Remember what I told everybody. Do not go out and stare straight at the sun. Okay? Don't do it. 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 If you don't have and if you don't have one of those crayon box things that make you look up in the sun, don't do it. Don't do it. No, they already said don't just put on sunglasses and look at the sun. Don't do it. Don't do it. Don't do it. You need real grown up equipment. I know us Appalachian folks think that we can just like jerry rig something together. You cannot. Okay, this is not. Do not go out and say, "Oh, I decided I'm gonna take a goat horn and I'm gonna drill a hole in the bottom and I'm gonna put a piece of glass. I'm gonna put a piece of Coke glass at the end of it, and that's gonna be." No, don't do it. Okay. I love my folk in Appalachia, and I love how ingenious we can be to get the job done. This is not one of those times. This is not one of those times. Okay? I remind you all. If I see somebody come on this call next month with a patch, I'm going to know who did it. All right. Everybody have an amazing week. Have an amazing month. Hope to see you at the Greenbrier. But if I don't, I'll see you somewhere in 2025, wherever we're going to have the next summit, because there will be another. All right. Again, thank you so much. And thank you for accommodating me being in a car and being on the move. Thank you.
Thank you for all the work you're doing, Tonya.
Thank you.
Ali, was that a finger thing? You had one more thing to say?
No, I was waving goodbye.
Oh, okay, goodbye.
Thank
Goodbye.
you.